Good evening. We'll call this meeting to order. Board of County Commissioners meeting. Today is May 9th, 2022. I will read the public charge. Board of Commissioners asks its members and its citizens to conduct themselves in a respectful, courteous manner, both with the board at any time should any member of the board or any citizen fail to serve this public charge, chair will ask the offending person to leave the meeting until that individual regains personal control. Should the quorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. Commissioner Burns, would you lead us in the Are there any agenda adjustments, Commissioner? None. We'll proceed with our announcements, and we will ask our clerk, Monica Wallace, she will read our announcements.
Good evening, everyone. I will read the announcements for tonight's meeting. Also, I'll let you know that the website and the emails will be available on our website and in our agenda packet, so I will not be reading out the long descriptions of the website this evening. 500 East Main Street mixed-use project construction to impact traffic, sidewalks, and parking. Construction activities for the 500 East Main Street mixed-use development will commence on Monday, June 6, 2022. The southern portion of the 500 East Main Street parking lot will remain accessible to public traffic. During construction, members of the public will have to utilize the new entrance on Elizabeth Street to access the parking lot. Because some of the sidewalks around the construction zone will be closed, pedestrians will be directed to the intersection of Dillard and Ramsier for street crossing from the parking lot and will be able to enter the Human Services Building using the Dillard Street exit. Deco Public Health COVID-19 Vaccination Clinic hours. The COVID-19 vaccination clinic at the Durham County Department of Public Health, 414 East Main Street, has the following hours to get your vaccination. Monday, Wednesday, Thursday, and Friday, 9 a.m. to 4 p.m., and Tuesday, 9 a.m. to 5:30 p.m. Appointments and walk-ins are welcome. All doses are available. Please note, clinics are closed between 11:30 a.m. and 1 p.m. daily. For more information, please visit the Public Health website. Vote in 2022 primary election. The early voting period for the 2022 primary and election continues through Saturday, May 14th. Election day will be Tuesday, May 17th. For location of voting sites, hours of voting, sample ballots, and more, be sure to visit the Durham County Board of Election website. You can also call 919-560-0700 with questions. Roll up and enroll. Join Durham's Partnership for Children and drop off your missing documents for Durham Early Head Start and Durham Pre-K. Staff will also be available to start the application process for either program, and Pre-K providers will be on site to answer questions about their facilities. For more information, please contact Grace Brown, and her email is listed in the agenda packet. Seed and Feed event on May 21st. The Durham Cooperative Extension and the Food Bank of Eastern and Central North Carolina are happy to announce that they will be giving away 10,000 pounds of bagged seeds donated by Cherokee Seed Company at a feed and seed event on Saturday, May 21st from 10 a.m. to 4 p.m. The event will be held at 2700 Angier Avenue. We're asking for a donation of non-perishable food items for the food bank, but donations are not required to receive seeds. Sale of seeds are strictly prohibited. Please contact G Vibes. There's an email address available, or you can call 919-560-0526. Register of Deeds temporarily closure. The Durham County Register of Deeds office will close to the public on Friday, May 13th, for the installation of a new operating system. This process will impact services for both internal and external users. During this period, the office will be unavailable to process requests for vital records, file documents, or allow online database access. The Register of Deeds will reopen on Monday, May 16th at 8:30 a.m. Please call 919-560-0480 for more questions. Innovate Durham application deadline nears. Local entrepreneurs seeking ways to develop and test their products and services with the local government of both the City of Durham and Durham County are encouraged to apply for the 2022 Innovate Durham program cohort. Applications are due by Monday, May 16th at 5 p.m. More information and the 2022 application can be found at the durhamnc.gov website. Budget public hearing on Monday, May 23rd. The Durham County Commissioners will hold a public hearing on the County Manager's 2022-2023 recommended budget during its regular session on Monday, May 23rd. Residents may sign up to comment on the budget at the meeting, submit comments to the clerk to the board's office, clerk@dconc.gov by 2 p.m. on Saturday, May 21st. You can also submit comments on the fiscal year 2022-23 budget portal for citizen comments that is found on our Durham County website. The manager's recommended budget for fiscal year 22-23 will be available to view following tonight's meeting, also on our Durham County website. And lastly, Deco Veteran Services to hold Memorial Day Remembrance Ceremony. Durham County Veteran Services invites all county residents to a Memorial Day ceremony in remembrance of the county's veterans who died while serving their country. The in-person event will take place at 9 a.m. on Monday, May 30th, on the steps of the Administration 1 building, which is the Old County Courthouse, located here, 200 East Main Street. This event is free and seating will be available. Guests may park on the street or in the municipal public garages. For more information, please call 919-560-8387. That concludes the announcements published in the agenda.
Thank you, Ms. Wallace. Before we ask any announcements from commissioners, we have one citizen I'd like to allow her to go ahead and come to the podium. I'm not sure if it's a Tiani Arando. If you would come to which podium over here. Minutes.
Hi, my name is Sunny Araldo, and I am the president of Durham Public Schools Instructional Assistant Association. We know that the budget's you're gonna be speaking about it on May 23rd, but we would just really like for you to understand that the cost of living increase that Dr. Mabingo's asked for in the budget is really needed for classified staff. Right now, we have instructional assistants, we have custodians, we have bus drivers who have to choose either rent and food and everything for their family or come to work. Right now, as you come in as an instructional assistant or anybody in the school system, you start off making $15 an hour. That does not cut it in this county. Right now, even I'm at a level 6, and we barely make it, and it's a little over $16 an hour. We have people who are single who still have to live at home because they cannot afford to live here in Durham. You have to make 3 times the rent to live anywhere. You have people moving out of Durham County to live, but they drive 50 minutes just to come to work because we love to work with our kids. So when you get ready to start discussing the budget, you need to take this into consideration because you have good teachers, bus drivers, cafeteria workers, everybody is leaving our district to go to other districts to work. If something does not get done, there will be nobody to work in the school system. And then what are you going to do when there's nobody to teach our babies? Right now, the Board of Education and our group and other groups are all in alignment with this increase. So it's up to you now to make the right choice and do what's best for the people who work and take care of our kids every day. It's just not a 9-to-5 job or whatever. We got out of school at 3:30 today. I didn't leave school until almost 4:30. I rushed to get something to eat and to be here on time. We take our hard-earned money. Every month we get paid. If there's something we need for the classroom, we get it. But you're not taking into consideration that we can't make a living. We have people who, this is a full-time job, they work another full-time job. Then we have people who work 2 or 3 part-time jobs after this, just so they can have food and gas and everything like that. We've asked for a meeting with you to listen to our concerns. We haven't gotten any response. So we would just really like to be able to get something done, take into consideration, we're not just here for the money. You know, the money is good, but we do this because we love our kids. But we can't love our kids if we don't have a way to get to work. Because if you haven't noticed, gas is over $4 now. Thank you.
Thank you, Ms. Geraldo, is that the way you pronounce your name, last name? Well, just to let you know, I don't know who you had that was supposed to contact us. And as the chair, I have not heard from anyone requesting a meeting. And I don't know if any of the... Then you should send the email to the clerk, and that way it'll go to all the commissioners. But given that I haven't received anything, I don't think any of the other commissioners has either. So that's why you haven't heard from us, because we haven't heard any. Okay, thank you. So I've got a couple of things that I want to announce, commissioners, and then if you have anything. May is ALS month, and I'm sure that you've heard a lot about ALS, and it's a disease that attacks the muscles, the nervous system, and this is a month to celebrate and fundraising for ALS, horrible disease of the nervous system. Also, we were, Commissioner Burns and I were at Durham Tech when Congressman Price and President Buckman announced the $1.2 million in federal funding that that's a joint RTP bio partnership. It's a new workforce development collaboration that unites biotechnology, biomanufacturing, biopharmaceutical talent pipelines of the 2 community colleges in the Research Triangle. That's awesome. We're so excited about it right here in our community. So the 2 things that I have that was on the agenda, commissioners, do you have?
Thank you for mentioning the NC Bio initiative, and I want to really lift that up because what it's about is a company that is partnering with both Wake Tech and Durham Tech to create apprenticeships and create curriculum. And we really want to encourage other employers to follow that lead. And that's exactly the kind of partnership that we want to see. I wanted to lift up the county manager's blog this month, her message, and I hope that we can get that added to our announcements because the county manager focused on this being Mental Health Month, which we're going to discuss here a little bit more about. And she did a great job of naming a lot of the resources that we have in the community. And unfortunately, people don't know about a lot of the resources, like our behavioral health urgent care center, where you can just walk in like our other types of urgent care, but this is behavioral health for children and adults, and is free. And so there are many resources that we have. And so I thank you, County Manager, for focusing on that in your blog. I also just wanted to add, there is something in our announcements about Durham Pre-K, but what is not highlighted is that May 13th of this week is the deadline for pre-K for anybody who wants to enroll in the pre-K through Durham Public Schools. So just, I hope we could get that added to that. And also that we have just launched with the city and the county a special van pool program for people to get to work who don't have a car or who may want to save on gas and carpool with others, and also an on-demand service for people to get to jobs in places like Trayburn or RTP that are not necessarily on easy-to-get-to bus routes. So I really wanted to lift that up and to again say, and I've said this before, to please encourage people to sign up for the Durham County newsletter because what you hear in our announcements is a fraction of all of the things that are happening every single week in so many different departments. We have many of our department heads here tonight, but just too much for announcements, but I just wanted to lift up those in particular. Thank you, Madam Chair.
Hearing none.
Just one,
Is there,
because we had to do a reschedule last week.
Commissioner Burns? I'm sorry.
Just really quick, for anybody who doesn't know, we didn't do Spring into Health. Okay, so Spring into Health was supposed to be last week, on May 6th. It is now rescheduled. It is also in the clerk, but I know it's a health resource education event where we're gonna have free hot food, food boxes, gifts. It was supposed to be more of a Mother's Day celebration, but we're gonna be giving out public health information about smoking cessation, chronic disease, opioids, substance abuse, diabetes. It is there'll be a Mother's Day special giveaway. So just so everybody knows, it'll be on our website, but it is actually going to take place at the Durham Housing Authority on Friday, May 13th. That's Friday, May 13th, and this is rescheduled from last week. It'll be from 3 o'clock to 7 o'clock at the Durham Housing Authority, and that's 533 East Main Street. So that was a reschedule, but that was all.
Right. So we're down to our minutes. We have our minutes before you, Commissioners, April 25th, our regular session minutes. Are there any edits or comments to the minutes? Hearing none, I'd like to make probably a motion for approval.
Second.
Has been moved by Commissioner Carter, second by Jacobs. Need a roll call by the clerk.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. Minutes have been approved unanimously. We have a few ceremonial items. The first one, 220236, is a proclamation, National Emergency Medical Service Week in Durham County. The board is requested to proclaim the week of May 15th to the 21st as Emergency Medical Service Week in Durham County. The theme of rising to the challenge is particularly meaning as it reminds our community that EMS professionals are faced with so many challenges and yet they consistently rise above them. And we're going to ask Jim Groves, our OES director, to accept the proclamation after Commissioner Burns reads that for us.
Durham County Board of County Commissioners Proclamation Emergency Medical Services Week 2022. Whereas emergency medical services is a vital and essential public service in Durham County, and whereas the members of emergency medical services teams are ready to provide life-saving care to those in need 24 hours a day, 7 days a week, and whereas the emergency medical services system consists of first responders, emergency medical technicians, advanced emergency medical technicians, paramedics, community paramedics, 911 telecommunicators, firefighters, police officers, educators, administrators, emergency nurses, pre-hospital nurses, emergency physicians, trained members of the public, and other out-of-hospital medical care providers. And whereas the number of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their patient care and life-saving skills. And whereas the Durham County Emergency Medical Services System maintained their high level of service and response throughout the pandemic, caring for and transporting a record number of patients, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas emergency medical services has grown to fill a gap by providing important out-of-hospital care, including preventative medicine and follow-up care through our community paramedics, and whereas it is appropriate to recognize the value and the accomplishments of emergency medical service providers in the Durham County Emergency Medical Service System by designating Emergency Medical Services Week. Now, therefore, I, Brenda Howerton, on behalf of the Durham Board of County Commissioners, do hereby proclaim the week of May 15th through the 21st, 2022, as Emergency Medical Services Week in Durham, and call upon all citizens to join with us in recognizing the vital and essential services provided by members of the Durham County Emergency Medical Services System to care for our residents and visitors. This, the 9th day of May, 2022.
Thank you, Commissioner Burns.
Thank you so much. I'm sorry. Just before I come up here, I'll go ahead and get choked. Jim Groves, I'm your Emergency Services Director for Durham County. Thank you so much for the resolution. I'd like to take time to recognize Chief Mark Lockhart, who is our Chief Paramedic for our EMS system. Mark's going to have a few words. Thank you all so much.
Thank you, Director Groves. Good evening, Madam Chair, Madam Vice Chair, County Commissioners, Mr. Attorney, Madam Manager, and General Managers. On behalf of the dedicated and incredible women and men of Durham County EMS, I want to thank you for this proclamation in recognition of EMS Week this year and recognize the people who make our county EMS system not just functional, but also exceptional. The fantastic team at Durham County EMS, Durham Emergency Communications Center, Durham Police, Durham Fire, the Durham County Sheriff's Office, Bahama Volunteer Fire Department, Lebanon Volunteer Fire Department, Redwood Volunteer Fire Department, New Hope Volunteer Fire Department, Eno Volunteer Fire Department, Duke Life Flight, and our partners at Duke University Hospital and Duke Regional Hospital. This year's theme for EMS Week, as you heard in the proclamation, is Rising to the Challenge. There is no more fitting theme, as that is truly what the dedicated team at Durham County EMS has done now for more than 46 years, and especially for the last 2 years. As the Swiss Army knife of healthcare, we work diligently to provide exceptional patient care to all we encounter, day or night, young or old, in the home or on the highway, and everywhere in between. We rise to the challenge. We hear the cries of the newborn we help deliver at home, hold the hand of the elderly neighbor who just needed to see a friendly face, administer COVID and flu vaccines to the homebound, treat the wounds of the shooting victim, resuscitate the mother of 3, and watch a terminally ill grandfather take his last breath. Regardless of who or why or where, we rise to the challenge. We are proud of our team's work. Our cardiac arrest return of spontaneous circulation rate is higher than both the state and national averages, as is our overall survival to hospital discharge rate. And now we face our greatest challenge. Our team is shrinking in numbers as our experienced practitioners are leaving to either advance their education or seek careers with other employers. We are seeing indications that exodus may be increasing within the next few weeks. We have worked with the county manager's office, human resources, budget, and others to address this growing concern, and we ask for your continued support as we identify solutions to rise to this latest challenge. Again, thank you very much for recognizing and appreciating the work of so many amazing women and men who are Durham County EMS. We are grateful for their commitment to this community and the exceptional care and essential service they provide each and every day.
Just want to thank you once again for the proclamation and recognize the importance of EMS Week and the heroes that we get to work with every single day inside and outside of Durham County Emergency Services and everyone that we're responding in the field with. We appreciate our stakeholders, our partners, and we especially appreciate you. Thank you.
Thank you so much. Thank you. Commissioners, comments?
Mine will be very quick because I do know we have a bit of a budget tonight, but I like what you said, the Swiss Army knife. I'm going to use that and give you absolutely no credit. So I did want to say, Jim, to your team, I think, clearly way before I came here, before I had this seat, I think I had close personal relationships with just about everybody on the paramedic services because, the Burns families had our share of tragedies and triumphs. And they get younger every day, and the level of maturity that they come into each situation with is laudable. I can speak to that from personal experience. So I hope that as tonight goes on and as this budget cycle goes on, that we're able to at least express that in another way other than just saying thank you tonight. But thank you both for your leadership.
Jacob?
Well, thank you, Jim and Chief Lockhart as well. I really appreciate the words that you shared, and just also want to express gratitude to all of our paramedics and everyone who works with EMS, especially during the past 2 years with COVID. Everyone, you all have been on the front line and more than in just ways that many of us have not, and people putting their own lives at risk, literally. And I want to echo Commissioner Burns that I know that we are going to look in this budget cycle to try to address the concerns that we have heard, and I appreciate that staff has made us aware of those as well. We know we all of us really depend, every single person in this community depends on all of you. So thank you so much. I hope that you all will be doing something for the staff this week. I don't know what you have planned, but I hope there will be something that people can enjoy. Thank you.
Well, I very much agree with the sentiments of my colleagues, Chief Lockhart and Mr. Groves. Thank you very much for your bravery, your ongoing commitment, your strong leadership. I really found your words, Chief Lockhart, to be very poignant. That was a really moving list of examples, and I bet there were recent ones. So thank you for sharing that with us. And I wanted to also say there is a great video, at least one, I think, on. Yes, I just happened to see that, and I thought, this is outstanding. It was really well done, and the young woman in it did a fantastic job of describing her role and the importance of it and her love of it. So anyway, thank you so much.
Shalom?
I won't repeat everything that my colleagues have already stated, but just echoing one point that Commissioner Burns has made was, the personal aspect that y'all bring to your work. my family and I, when we first moved to North Carolina when I was 5 years old, I had severe asthma, and I'm severely allergic to pine trees, which is just everywhere here in North Carolina, and I had an asthma attack. And, not only did the EMS come and literally save my life and take me to the hospital, but my immigrant parents, who didn't know any directions, didn't know how to get around, they made sure that, they were able to find their way to the hospitals as well and able to bring me home safely. So I know that the EMS services always goes above and beyond to make sure that families are comfortable, and we just can't thank you enough for that.
So I'm just going to say ditto, ditto, ditto to what all my commissioners have said, and on behalf of all of your staff, the people that you take care of in this community, thank you.
Commissioner Carter, I'm going to skip down here to 220240, Proclamation on Older Americans Month proclamation. The board is requested to proclaim May 2022 as Older Americans Month. And Ben Rose is here, Director of DSS, to hear details and accept.
Who did I give it to? I'm sorry. All right, go ahead.
Durham County Board of Commissioners Proclamation, Older Americans Month 2022. Whereas Durham County includes a growing number of older Americans who contribute their strength, wisdom, and experience to our community, and whereas Durham County is a diverse community and benefits when all people of all ages, abilities, and backgrounds are welcomed, included, and supported. And whereas Durham County recognizes the need to create a community that provides the services and supports older Americans' need to survive and thrive independently for as long as possible. And whereas Durham County is working toward building an even better community for our older residents by creating, developing, and implementing the Master Aging Plan, planning programs and using technology to support independent living, ensuring activities are responsive to individual needs and preferences, increasing access to necessary services that support aging in place, fostering cross-sector partnerships to streamline access to services and ultimately expand community living, confirming all people, regardless of race, ethnicity, gender, age, or disability, have the right to make choices and decisions about their own lives, to live independently for as long as possible, and participate fully in their communities. We commend this observance in our community and urge all residents, community agencies, faith groups, medical facilities, and businesses to join with the Department of Social Services, the Durham Center for Senior Life, Dementia Inclusive Durham, and Aging Well Durham to honor older adults and those who care for them during May and throughout the year. Now, therefore, I, Brenda Howerton, on behalf of the Durham Board of County Commissioners, do hereby proclaim the month of May 2022 as Older Americans Month in Durham County. We urge every resident to recognize the contributions of older citizens, help to create an inclusive society, and join efforts to support older Americans' choices about how they age in their communities. We commend this observance to our community and urge all residents, community agencies, faith groups, medical facilities, and businesses to join with the Department of Social Services, the Durham Center for Senior Life, Dementia Inclusive Durham, and Aging Well Durham to honor older adults and those who care for them during May and throughout the year. This, the 9th day of May, 2022.
Good evening. Thank you so much for the reading of this great proclamation, and thank you for your acceptance of it tonight. This proclamation means a lot more to me now as a caregiver for a parent with dementia, and it really has really emphasized to me through a personal lens what caregivers deal with and go through, and it's really challenging. So we thank you and are very gracious for this proclamation. The program shared a brief note that I wanted to share with you. This comes from our Aging and Adult Services program. In 1963, when Older Americans Month was established, only 17 million Americans had reached their 65th birthday. At that time, interest in older Americans and their concerns was growing. A meeting in April of 1963 between President John F. Kennedy and members of the National Council of Senior Citizens led to designating May as Senior Citizens Month, the prologue to Older Americans Month. Historically, Older Americans Month has been a time to acknowledge the contributions of past and current older persons to our country, in particular those who defended our country. Every president since President Kennedy has issued a formal proclamation on or before the month of May, asking the entire nation to pay tribute in some way to older persons in their communities. Diverse communities are strong communities. Ensuring that older adults remain involved, stay included, and have a sense of belonging for as long as possible benefits everyone. The 2022 theme for Older Americans Month is Age My Way, and is an opportunity for all of us to explore the many ways older adults can remain independently in their homes and continue to be immersed with their communities. Older adults play vital, positive roles in our communities as family members, friends, mentors, volunteers, civic leaders, members of the workforce, and more. Just as every person is unique, so too is how they age and how they choose to do it. And there is no right way. That's why the theme for Older Americans Month is Age My Way. Governor Cooper shared in his state proclamation that North Carolina is now ranked 9th in the nation, both in population and in the number of people over 65. It is now estimated that there are more individuals over the age of 65 than under the age of 17 in our state. Durham models closely after the state with these growing demographics and in longer lifespan. In 2020, Durham finalized its major master aging plan to ensure that all older adults in our community could age in place and age their way. Older Americans Month is a great opportunity to celebrate our parents, grandparents, and all those special individuals who have impacted our own lives. Let's all look for opportunities throughout the year to give back to older adults in our lives and to help them live more independently as they age. And that's from our program. And we, again, thank you for this proclamation, and we thank you in celebration of our senior citizens and older adults who are really special to us in DSS. Thank you.
Thank you so much, Ben. You know, as you were reading that, I was trying to think the number of senior citizens that are in the community. We had that number one time. I can't remember what it is.
I don't have that actual number handy, but it is projected by 2034 that there will be 77 million 65 and older, and that will be the first time that as a country it will actually be greater than children or people 17 and under. I guess there's children in it.
Wow.
Although my daughter would say differently, but yeah, it's actually it is a growing population, which was really important. I think that this master aging plan was developed. It was good timing because the services for older adults are still very challenging. There's, as you know, there's waiting lists for a lot of services. A lot of these services are capped grants that come through, but our partners, especially the senior center, adult daycare, these kind of services are really critical in helping people stay independent at home as best they can. And support caregivers. Again, something I've been doing now for the last 8 months, and it's really important that self-care, you know, because it's like having, I hate to say this, it's like having a child again in some ways when you deal with a senior that has late-stage dementia, and it's very taxing and tiring, and it's really important to have those support services and respite services available, and they're very limited and very hard to come by.
Thank you. Thank you. Commissioners, comments? Start with you, Commissioner Alon.
Thank you so much and to the DSS staff for continuously bringing things forward to the board so that we can celebrate and make sure that we do our part as commissioners of reaching every single community member and not leaving anyone behind. And it really does seem like every time we have you before our board that I wonder, is there anything DSS does not do? So just really thankful for all of the hard work and dedication that your staff puts in, because I know it's also emotional work that all of them are putting in every day.
Very much so. Thank you so much.
I don't really have much more to say other than the beautiful words, Ben, that you read from your program and also from the resolution. I mean, I will say, let's, especially as I get closer and closer to the age of elder, let's be sure we honor our elders, upon whose shoulders we stand, and especially caregivers. That's meaning more and more to me, I think, as I have more and more people in my own family age. So thank you so much for this proclamation.
Thank you. I share that sentiment as I get older, too. I now get the senior cut at Great Clips, but of course, it takes 5 minutes to cut my hair, so I'm not sure how much they're really saving with me. But I agree with you. Thank you.
Well, thank you, Ben. And I just have to share that Ben, not only, it's been hard for every staff person in Durham County government during COVID, and I just have to lift up Ben because as a member of the DSS board, seeing his leadership during COVID, but then losing his mother and then being the caretaker of his father, who's been in and out of the hospital, has been really humbling, Ben, and also how the staff has supported you when you've needed to take care of your dad and your family. So thank you for modeling the way for all of us, your compassion. But I'm really glad that this proclamation does talk about the caregivers, because that's something that we don't talk about enough, and how dementia impacts family, Alzheimer's, and just any type of physical needs that we go through with our family members. And we know, everyone knows who's been through it. It impacts everybody at some point in their lives. I want to just make sure that everyone knows about the conference called Age My Way that is going to happen on Saturday, May 21st. And I will make sure to send it out to all of our board, and also that we get it into our announcements for our next meeting. Actually, we need to forget that our meeting is going to be after. So we better just get it on the Durham County website. But the Durham Center for Senior Life is hosting a conference, lunches included, from 9 a.m. to 3:30 p.m. And it's $15, and it's for there'll be a caregiver track and a community track, and it's about educating and empowering caregivers and the community around dementia. So I encourage folks to spread the word about that, which is part of the celebration of this month. Thank you.
Thank you for sharing that.
Commissioner Burns?
Getting at that age where, you know how you get my age and people have little ones, and then you have to take care of your parents like the same. Oh, can you hear it? So, I don't want to jump on this one too. It has been a trying year, you know. Both my parents are getting up there, and it gets to be different when you get this age. And I'll just pivot. We came, we had our meeting this week, but we did pass, you know, a holiday. We passed Teachers Appreciation, but we also had Mother's Day this week. So let's just not take anything for granted. Not take anything for granted. And I hope that as we think about this proclamation, we recognize that the same way they advocated for us, we now have to advocate. Ask about me at the Triangle Wide Hospitals. Pretty sure I'm banned. But I hope that when you look at this proclamation and you think about the work that we do, when people ask me all the time, oh, well, we want to do this to raise taxes. I think my board is pretty much lockstep that we don't want to continue to vote out the people that voted us in. And the first thing I usually ask people is, well, what do you want me to cut first? Mental health services, senior gerontology, or do you want me to cut our social services? And nobody wants to cut anything. And I can tell you right now, you're looking at a board of people who will not, as long as we're sitting here, cut anything for older Americans, or as I like to say, sensibly seasoned Americans. So I like this proclamation. I hope that we can do more. I hope you all can come to the event that Commissioner Jacobs talked about. And above all else, go home and hug somebody. All I got.
So, Ben, I was just sitting here as we're talking about older adults. I'm looking around at my board and going, am I?
Seasoned. Sensibly seasoned.
I am not going there, y'all.
Seasoned.
So, again, thank you for all the work that you do. And, it is hard work when the commissioner says it's hard work that you do. So thank you and your staff for all that you do. And caregivers, tough. Thank you again. All right. Now, Commissioner Carter, I'll be back to you. I kind of got around here. 22047 Proclamation Children's Mental Health Awareness Month. You will read that one for us. And here. That you too, Ben?
Chair Howerton, Tika Dempson.
She's not here.
Yes, she reached out and stated that she apologized, but after 18 years of being in person to accept
Yes.
proclamation, she would not be able to attend in person. She is watching on YouTube, and she has asked that I accept the proclamation, and I told her that I would mail it to her first thing tomorrow.
Thank you, thank you. And we do miss her. Tika, if you're watching, we do miss you today because you're always here. 18 years, that's a long time. And we appreciate all that you do. And we will have Commissioner Carter. You will read the proclamation.
Yes, thank you, Madam Chair, and thank you, Ms. Tika Dempson, for providing this proclamation for us tonight. The Durham Board of County Commissioners Proclamation Children's Mental Health Awareness Month 2022. Whereas, addressing the complex behavioral and mental health needs of our children, youth, and families is fundamental to the future of Durham and North Carolina. And whereas the leadership in Durham, North Carolina recognizes that addressing the complex mental health needs and treatment be on par with medical needs and treatment, and addressing the social, emotional development of children is essential to early foundations which will ensure the best outcomes for our children's well-being. And whereas the United States Department of Health and Human Services has identified that 1/5 of our state's 2.2 million children live with a mental health condition, and the North Carolina Center for State Health Statistics data reports that suicide is the second leading cause of death for children ages 10 to 17 in our state. Families shall not feel stigma or shame to seek treatment for their children and youth, and they shall be able to discuss openly their need for help without public retribution. And whereas research shows it is important to seek help early and get effective treatment for trauma, mental health challenges, and substance use disorders among children and adolescents, and provide them quality opportunities to live resilient, healthy, and productive lives. And whereas available school-based mental health programs and positive behavior interventions and supports should be considered as best practice and be encouraged in every Durham, North Carolina public school. And whereas children are recognized for having unique needs for recovery of mental health, emotional, behavioral, and substance use issues, and should not be combined with the adult mental health population for treatment. And whereas Durham understands children with mental health challenges and their families benefit from access to timely services, supports, and crisis response systems that are family-driven, youth-guided, and culturally appropriate. They also benefit from the integrated behavioral health in the health care, education, child welfare, and juvenile justice systems. And whereas the Durham County Commissioners, along with the state of North Carolina, is demonstrating its commitment to children's mental health through all child, youth, and adult serving systems to support children's emotional resilience and well-being. Emotional and behavioral health issues join together to recognize Children's Mental Health Awareness Month. Now, therefore, I, Brenda A. Howerton, on behalf of the Durham Board of County Commissioners, do hereby proclaim the month of May 2022 as Children's Mental Health Awareness Month in Durham County and commend its observance to our citizens. This, the 9th day of May 2022, Brenda A. Howerton, Chair, Durham Board of County.
Thank you, Carter. Are there any comments regarding this proclamation? We just had
Well, I know there's been a lot of recent media coverage about the high rate of suicides amongst our youth, middle school and high school students. There've been some excellent reporting lately. And I would just say to our board, I hope that this is something as we look into the budget and, where to focus some of our fundings. One of the problems that we have is we don't have enough adequate treatment facilities for who need severe and persistent mental health issues. That's an area we're really lacking in our kind of ecosystem of resources here in Durham County. So I hope that that's something we'll discuss further.
This is just a quick stat. I said I wasn't going to speak on each one of them. I'm going to keep doing dittos like my chair. But a lot of you all were not here for the work session. Somebody keep me honest if nobody remembers it. Suicide amongst children in Durham is too high. I was going to say it's just one is too high. But we saw some staggering statistics. One of the ones was African-American children between the ages, I think, of 1 and 14, were 3.5 to 4.5 times more likely to commit suicide. So not only do we see these mental illnesses affecting our children, we actually see them bothering our children in different capacities based on their race. And I think that that's something that this board, we zeroed in on that day. I mean, I think every presentation we got that morning. So I want to lift up something that Mayor O'Neill said when she got in the office, and I think a lot of the work you see us doing, people are always saying, what are you all going to do? What are you all going to do? I'm turning it back on y'all. What are y'all going to do? Because we can't do it by ourselves. Our babies are leaving here every day, and I think every person, whether you sit on this side of this table or that side of the table, has the capacity for change. And you don't have to be a mental health specialist to give a hug. So I just hope that, as we're looking out at our kids, especially as they're pivoting out of a pandemic and they don't know what to do with their own emotions, that we just say, you know what, I can take 3 hours or 5 hours and I can do something, and maybe that's how I save a kid's life.
Thank you, Commissioners. We have one more proclamation, and I am glad that I was able to kind of lump these together. The mental health is one of our top priorities in this budget. And the proclamation that I'm going to read now is the National Foster Care Month. And Ben is on his way to the podium. So, and with, before I read this, with COVID, it's had such an impact on not just adults, but on children. So when we talk about mental health, it's been very, very devastating to our children. So National Foster Care Month 2022, where strengthening families and focusing on their well-being
is vital to building strong communities and preserving families in the primary goal of the child welfare system. And whereas foster and kinship care families play an important role in supporting biological parents and helping them enhance their relationships with their children to achieve family stability and maintain family connections in support of family reunification. And whereas more than 407,000 children and youth are in foster care nationwide, and foster families open their homes to provide a stable, nurturing environment. And whereas more than 11,000 children and youth live in foster care in North Carolina, and more than 1,000 youth in congregated care, such as group homes and residential treatment facilities who need a foster home. And whereas on April 1, 2022, 294 children and youth live in foster care in Durham, North Carolina, and the 13 youth in congregate care such as group homes and residential treatment facilities who are in need of a foster home. And whereas every child deserves to keep the meaningful connections they have with relatives and fictional kin, during the journey to permanency, and when this is not possible, the needs of the foster care population results in a greater call for dedicated foster families, community resources, and partnership. And whereas during National Foster Care Month, we celebrate all those who have invited a child in need into their hearts and homes and express our deepest appreciation for those who make foster care possible. Now, therefore, I, Brenda Howerton, on behalf of the Board of County Commissioners, do hereby proclaim the month of May 2022 as Foster Care Month in Durham County. We commend this observance to our community and urge all citizens to reach out and support kinship and resource families to help raise hope and foster dreams of children and youth in foster care. This is the 9th day of May, 2022.
Thank you again. I'm back. I'm spanning the age range tonight and happy to do so. This one is very special to us in DSS. Foster care is just one of those unique services that we have that involves so many partnerships in our community between foster parents, guardian ad litem, the courts, attorneys, who we have a wonderful legal team under the leadership of Attorney Darby. We have providers, just so many players helping this. But the biggest partner that we have are the families, both the foster parents and the families involved, because foster care is about trying to get permanence, and hopefully that permanence is getting that child back with the family and getting those issues resolved. And that's what we really focus on first and foremost, reunification. But then if we cannot get there, that we have other options, and kinship care is something you're going to start to hear a lot more about, because that is really a focus of Families First, the new federal law that is being slowly implemented in North Carolina over the next few years. In addition to kinship care, we're going to be looking at trying to keep families even together more and preventing and reducing foster care, which is a good goal. It's going to be really a culture shift in some ways in how we practice child welfare, but it's going to be some critical shifts in practice, I think, that will be important for our families and hopefully keep families together. So this one is very special to me. This is why I got into DSS. This is why I do child welfare. Is kind of my passion and my heart, and I am just grateful for the acknowledgement of this month as we celebrate the foster care system and all the partners that we have in it. Jovetta is here. I'm going to definitely not, I don't want to steal her thunder, so I'm going to let her speak from the program perspective, and then we'll be happy to entertain any questions.
Good evening. And again, I stand before you to say thank you for supporting child welfare in all our endeavors, particularly tonight in recognizing Foster Care Month. I'm not going to say too much more than what Director Rose has stated, but just want to emphasize that as North Carolina begins to move forward, we will be putting more emphasis on keeping families together. So the 3 proclamations that you're hearing tonight, they all fit so well together like a piece of a puzzle, and we can't do anything in supporting our children or families without the resources that have been discussed. Mental health is a huge issue in the foster care system amongst our families, our birth families, and our young adults and children, and so we need all support, whether it's biological families, fictive, godparents, whomever, to support the children who are in care. And so as North Carolina begins to shift to families first, the Children's Bureau focus is on, we need to focus more on the supports for our fictive and kinship families, and they need those resources just as much as we're pouring into our resource families, which most of you know as foster families. So again, I thank you for your time. We will be recognizing and celebrating our families at the Durham Bulls Park, another partnership come Thursday. So this will be the first time we've been able to gather in 2 years, and our resource families have truly missed that opportunity to fellowship and celebrate and just bring awareness to the system. And so if you have a chance and you're out at the Durham Bulls ballpark and you see a family, just say thank you. Just let them know thank you from your heart for all that they do.
What time is that? Is it all day or?
The ballpark, the game starts at 7 o'clock.
7 p.m.?
Yeah.
Thank you.
And I did fail to mention that in Durham, the numbers in care are dropping. Over the last 3 years, we have seen a slow decrease in the number of kids coming in care. Durham, you know, is a very progressive county, and that doesn't mean that so is DSS. And we've been trying to focus more on keeping families together and keeping kids out of foster care, being creative and using the resources that we have been given by the county and or the state to keep families together. So hopefully as the years go on in the next couple of years, those numbers will decrease. 1 child in foster care is too many. Going from 330 to 296, that's great, but we need to drop it even more.
Thank you, Javetta and Ben. Commissioners? Commissioner Carter?
Say thank you first to Ms. Whitfield and Director Rose. You guys come to the podium and say, this one is really special. They're all really special to you, I can tell. So thank you for that. Thank you for caring so much. My question is about the new approach, NC, what was the name of it again? Children First, Families First, and the resources that requires. Could you give an example of the use of some resources that helps keep families together, and possibly, areas where the state is going to bring more resources to bear, or we may be seeking more resources at the local level?
So, yes, this is, what's really exciting about this is the federal legislation allows us to shift our funding to actually fund preventative services, which is a first. It's called Title 4E, which is a fancy word for some federal funding we get, but Title 4E always was activated when a child came into foster care. Now we're going to be able to use those funds while the case is a CPS case or an in-home case. So such services as parents as teachers. We're going to have a lot more intensive in-home services that we can fund with these federal dollars to try to resolve issues in the home. Another element that we're going to be dealing with is the state is also undergoing child welfare transformation. So that is, and it kind of mirrors in some ways Families First, but one of the aspects I think that's going to be critical there is that kinship family relationship that we've talked about. Really trying to they're going to actually create a model of practice for us that really employs the family even more than we partner with the families now, but we're talking about really engaging with families to try to create resources within that family. to say, okay, this is where a child can perhaps live temporarily while we work on these issues versus us filing a petition and going to court and getting a non-secure custody order. So those are kind of some of the examples. And there's about, under Families First, there's going to be about 3 or 4 different services that that the state, it has to get approved by the state, and they're working on. Parents as Teachers is one.
There's 2 other
I'm
parenting
blanking
models.
on the other one, the big one. Oh, gosh.
P.
Triple P, thank you. I'm getting dementia now, too. Triple P. Triple P parenting is another big one that has really been a very effective tool. I've actually used that tool in previous counties. We were, in the county I was in before I came to Durham, we were one of the only counties that actually had trained certified instructors within our DSS, and it's a really effective tool in helping address those issues. Usually they're typically maybe severe neglect or even some mild abuse, but we can try to keep those families together and really get intensive in-home services to them. That's going to be just so exciting, and it is going to be a shift. It's going to be, our focus has always been safety, but now they're talking about with child welfare transformation, taking more risk, which is going to be a little nerve-wracking to us in terms of we might keep children in situations where we would not do that in the past, but to really try to put in very intensive wraparound type services to keep that family together and try to work through those issues and prevent that custody. Yes, definitely. It's going to, yes, it is going to, it's going to be a big challenge, but these are proven models, and I think we just have to really get our workforce, and I'm talking about not just Durham County, but the state, the workforce shift is going to be really big. It's going to take a lot of training, and it's going to be a heavy lift by the state to do this. Definitely. Thank you.
Okay. Commissioner Jacobs?
Thank you, Jovetta and Ben, and I'm glad that you did get to go into that a little more in depth. I really want to lift up just what incredible work all of our staff does who are involved with child welfare and the foster care program. As Jovetta mentioned, everyone has been working so hard in partnership with families, with really trying to support families and keep children, with a relative, but within the family. Those drops in numbers are evidence of that. And also, maybe you could talk a little bit about. I've been so impressed with the support network around the foster parent, and I just want to also recognize and thank our foster parents in our community, because it is a partnership, and every single piece of it, we need all of it. It could not happen without everyone. And I know that you and your staff, everyone has been really creating this wonderful support network. Could you just talk a little bit about that, Jovetta?
So we have what we call our Recruitment and Retention Committee, and it does involve staff as well as resource parents. Plan for how to recruit, retain, and resource families to support the youth who are coming into care. So they do meet, and they have developed a newsletter, and they're trying to disseminate that information. They're also trying to just create a bond within their own network to support each other as resource parents. So that's one effort that is being done. There's also, it's not really the Foster Parent Association, but fostering families, I'm going to say families moving forward, fostering families, and they too have partnered with the Triangle. So it's not just Durham resource parents, but it's also the Triangle resource parents to support one another.
Thank you.
They have done tremendous work as well, and I'm with you, Commissioner Jacobs. I mean, think about what foster parents do, just opening that door, and the training they go through is wonderful training, but still, when you're bringing in a child that has gone through a traumatic experience, and, we talked about the mental health situation, we experienced that ourselves last week in our office, and we had foster parents take these children in that were going through a mental health crisis. And really, it's just amazing what foster parents do and the sacrifices they make. And they are truly heroes in our department. And we have an awesome recruitment team. We have an awesome licensing unit. We have awesome foster care social workers that really, they work around the clock and just really try to help stabilize placements and support foster parents as best we can. They are true heroes. So thank you for acknowledging them.
Thank you. And I want to recognize Commissioner Card and I were able to be at the Cooperative Extension yearly report last week, and I picked up their Welcome Baby report. And so I think making sure we leverage those other credible programs, because the parenting workshops, they do the Triple P, Mother Read, Father Read, Positive Discipline, Incredible Years, Partnership for a Healthy Baby, and last year they served 250 children and 170 families just with those parents, and there's a whole lot more, but hopefully we get some additional funds. We can build on that interview support. Thank you.
Commissioner Burns?
Quick yes or no, because I know my chair is ready, but it does go, for everybody who doesn't know, I didn't know this until last year. Foster care does go up to age 21. Am I correct?
Correct.
Yes, okay, so I retain things being, and so I think we keep saying children. We don't need to get lost in age 7. So foster care does go up to age 21, and everybody doesn't have to be a foster parent. The same way we talk about wraparound services for everything else, in the middle of the night, a kid might have to leave, and what do they need? A suitcase. So we will take suitcases. In the middle of the night, we might drop that kid off at somebody's house, and that kid is actually an infant, and you know what that family needs? Diapers. So just because you can't be a foster parent, that does not mean that you cannot be a part of making that ecosystem healthier. So as we look at this proclamation, think about what a kid in college that might need your help. Think about grabbing an extra pair of diapers or donating that old suitcase that's in your house. For the rest of this year, I'm going to do my best to say, yeah, Commissioner Burns can help, but I'm literally looking back at everybody here because I do think we all have the capacity for change. Thank you so much for what y'all do.
So again, Davetta and Ben, thank you so much for what you do. You know, it starts at birth. The work that you do starts at birth, and it doesn't stop until the grave. So that's the full spectrum of the work you do. Thank you so much. Thank you for bringing this proclamation.
Thank you for all your support.
Thank you.
very much.
So Commissioners, we are down to one of the big highlights of the evening. After I read the introduction here, I am going to ask the commissioners if they will have a seat out in the audience here. 220262 FY22-23, a manager's recommended budget presentation. It is this time that I'd like to introduce our county manager, Dr. Kimberly, as she formally presents the recommended budget for FY 22-23, the Durham County Board of Commissioners. This is in accordance with North Carolina General Statute 159-12 of the Local Government Budget and Fiscal Control. Yours?
Great. Good evening, everyone. Dear Howerton, members of our board, commissioners, to our county staff, and to the entire County of Durham residents. It is my extreme pleasure and my honor to present my very first manager's recommended budget for the fiscal year 2022-23. And before I dive in, I would very much love to thank the county staff that have helped to onboard me during these last couple months. As you can imagine, it has been a very daunting task. But taking on the challenge of understanding such a very complex and dynamic organization, such as Durham County, could not happen without the help of an amazing group of staff, talented employees, and I want to thank them for their dedication, for making sure I was prepared and understood what it took to put together such a dynamic and involved budget. So thank you so much to staff for your help, and especially to General Manager Claudia Hager, to Keith Lane, David Ades, and the entire budget team. Thank you all so much. This annual budget development process, which culminates in the document, can be conceived as a consensus of county needs, okay? It's a revaluation of county direction and a fiscal application of county services and expectations. So my task as county manager, especially a new one, during this budget process was to clearly understand board directives, your expectations, and to set those in comparison to existing county programs and services, and balance all of that under an umbrella of available fiscal resources. The framework for developing this budget is best characterized by a mixture of optimism, growing needs, with a dash of uncertainty, okay? The optimism comes from the fact that the pandemic's most damaging effects are receding. There's optimism that Durham's local economy will continue its vibrant growth. And there's also optimism that significant federal stimulus funds will be able to support strategic investment in the county's future, as well as ongoing COVID health and economic relief strategies. The growing needs are reflected in the many goals and objectives identified by our board, the important concerns relayed by our citizens, and budget requests presented by departments, and there were many, and an economy that continues to stratify both winners and losers. The uncertainty comes from an economy that's changed by a pandemic, a local economy that, while it's strong now, it may slow in the near future. And the economy affected by inflation and supply chain disruptions creates a lot of uncertainty. So the economy is what refills our county coffers every year. And what the future holds is always a little uncertain. With that in mind, my recommended budget, through judicious funding decisions, reflects Durham County's response to significant internal and external pressures, both known and unknown. Currently, we're navigating a host of social, economic, as well as public health challenges. And to navigate these complex dynamics, the Board of County Commissioners has a guided strategic plan. This plan consists of 5 strategic goals and related objectives and strategies, which tie together service delivery within departments. This guide also places a very high priority on collaboration among departments as well as the community. So development of this budget was predicated on the second straight fiscal year's significant growth in major revenue sources. Durham County, from downtown to the Research Triangle Park and all points in between, continues to grow in terms of business location, job expansion, and a desired place to live. All of these economic drivers are in turn pushing major revenue sources higher and higher. And yet, we still see, feel, and recognize the need for so many more services and more intensive existing services, new programming that will help us deal with arising issues. So as a part of our fast-growing community and the amazing growth in revenue that we've seen, we also, though, see that it's offset by an even faster set of growing expenses. Ultimately, this budget is about meeting the near future needs of the community with an eye towards the ongoing sustainability of Durham County's vibrant economy, the vibrant culture, and vibrant life. So keeping all of these dynamics at the forefront, key priorities that have been built into this recommended budget attempt to apply significant revenue growth to the most important areas that will provide the best outcome. My first priority, giving such impressive revenue growth, is to implement services at a pace that allows us to maintain our general fund property tax rate at the current level. Second is the annual appropriation of ARPA funds to support the daunting pandemic aftermath needs of our community. And another important priority is protecting the economic stability of our employees by compensating funding that keeps up with inflation and supporting the existing benefits. So broadly speaking, estimated revenue growth for the upcoming fiscal year is distinctly positive. Major revenues include property tax, sale tax, Medicaid hold harmless funds, occupancy tax, as well as EMS patient fees. In fact, Durham County, like many other counties across the state, saw strong growth in sales tax revenues. This is a direct reflection on local economic activity, as well as growth in city and county property valuation, which in turn increases property tax revenue collection. However, even with this significant natural growth in our key revenue sources, the financial needs presented to and by various departments across the organization are significantly higher than this natural growth in revenue alone can fund. So the fundamental challenge for development of the 22-23 fiscal year budget is that even with significant natural growth in the key revenues, which totaled approximately $32 million, here you can see the 6 key priorities that consumed most of this growth. And these priorities totaled approximately $30.2 million. The last 2 years, within the specter of a pandemic, county staff has steadfastly worked the COVID front line. They've worked from home, they've worked on vacations, they've delayed or not even taken vacations, but yet they still provided emergency services. They still provided public safety for our citizens. They met directly with citizens in need and zealously protected the health and welfare of our citizens, as well as other county employees. In short, they have done and continue to do an amazing job, all while stress levels and job vacancies continue to rise. Our employees deserve to have salary increases that at the bare minimum keep up with inflation. And we want to make sure that our county employees also earn salaries that are competitive with those that are among our peers. So now, before I talk about next year's compensation recommendations, I'd like to proudly review some of the key changes that we've made to address some of the employment conditions and the employment needs of county staff. There's been a very real struggle to fill vacant positions. It's not just here, we're seeing that being experienced across the state. We see employees that are leaving high-stress jobs. It's hard to overcome the organizational knowledge that leaves when we have retirements, and retirements are increasing. So to that end, during this current fiscal year, in trying to combat the pay inequities, the vacancies, the work-life issues that many of our employees faced, the county supported a 3% cost of living adjustment. We increased pay for approximately 350 hard-to-fill positions. We implemented referral bonuses, longevity pay, pay vacation incentives, as well as retention bonuses. So now let's look to discuss what we propose to do for our upcoming fiscal year. So the major of all employees' compensation recommendations help us acknowledge and demonstrate our very real and sincere appreciation of our employees. $4.5 million of funding is provided for implementation of a full-year cost of living adjustment for employees. $2.8 million is budgeted for the annual merit pay increases based off of annual performance reviews and is recommended to increase to 3% for meets expectations and 4% for exceed expectations. In total, all employees are eligible to receive from a minimum of 5.5% pay increase up to a maximum of 7.5% increase. However, that alone does not offset or directly confront the continuing vacancy issues that we're facing for nearly every department in the county, especially for our public-facing departments, especially in the area of public safety. So to that end, longevity support, along with hiring bonuses, are also a part of this overall compensation changes in the upcoming budget. And specifically related to public safety, additional funding is budgeted for EMS salary adjustments so that they can remain competitive with surrounding counties. We are also proposing a 5% salary increase for law enforcement and detention officers, as well as nighttime shift differential pay increases for detention officers. This budget also supports continued investment in our employees by recommending additional funding for the tuition reimbursement program for county employees. Finally, a comprehensive compensation study beginning before the end of this current year will review the entire compensation package provided by the county, taking into account the new forms of remote work available to employees, as well as the stress and strain of public-facing positions. Should the compensation study recommend financial strategies to create a more equitable salary structure, I will strongly encourage our Board of Commissioners to fully fund those recommendations because they will certainly play a critical role in the county's ability to remain competitive, in our ability to retain, recruit, and attract a talented workforce. So now let's move into one of the priorities we know that is high for our Board of Commissioners. Let's talk about education. Durham Public Schools continues to be the single largest recipient of county funding, and the recommended increase for this upcoming year is $9.88 million. In fact, the very size of the funding to DPS makes it progressively more challenging to fund the natural growth in revenue in order to support the annual increases. As you will see here, there are other high priorities listed in order of approximate additional costs for the upcoming year. And of course, there are other additional new and expansion costs throughout the general fund budget that are not included on this list. Now, as a part of understanding and developing the estimated fiscal year 22-23 property tax revenue, it's very important to assess how current year collection is progressing. Current estimates of year-end property tax collections have the county surpassing budgeted amounts by 3%. And this translates to approximately $9 million. The high growth in collections for the current fiscal year is largely fueling property tax revenue growth for the upcoming fiscal year, while on top of that, there is a stacked estimated property tax revenue growth for the upcoming fiscal year. This equates to a double hit of revenue growth. Now, this natural growth on property valuation is 4.4% higher, or $2 billion, from the current year to the next year. And while this is significant growth, it is important to emphasize that this captures the growth from the current year's valuation as well as growth for this upcoming year. All the above explanations translate into estimated additional property tax revenue of $13.9 million for the general fund before any property tax rate increase. And now I'm excited to note that in this recommended budget, I am proposing that we maintain the current property tax rate. Growth in other available revenue sources, as we've noted above, and the judicious application of those dollars, we will use those resources to help fund the services and programming for the upcoming year. Now, while I am proposing that we maintain the current property tax rate, there may indeed be a need to increase property tax with the requested potential passage of a $550 million general obligation bond referendum. This budget was also developed with the understanding that the county looks to maximize efficiency of current processes and services, while also limiting expansion of services to areas that provide the highest return on our investment for all Durham County residents. So we look to budget property tax revenue in two different categories. One to support general fund expenditures and the other to support capital financing funds. The capital financing funds pay for capital projects and debt service. And so I would like to remind the board and Durham County residents that the property tax rate is our primary source that is controlled by our board and the only significant way to raise additional revenue in future years. So while I am recommending to maintain property tax rate for this upcoming fiscal year, it's important to note that the rate remains flat. So future tax rate increases may be needed to help us support ongoing county goals, including our significant commitment to Durham Public Schools, to capital planning initiatives, as well as other initiatives. Here, on the current slide, we will note that there is no property tax rate increase for any of our special tax districts. We've experienced strong growth in property valuation across all of the fire districts, as well as the RTP special district. And it cannot be overstated that the value and the valuation of our strong and vibrant local economy has made a tremendous financial impact on Durham County. Next, we'll look at this, the total amount of budgeted sales tax revenue for next fiscal year, which is $106.1 million. Now, for perspective, this is the equivalent of 22 cents of property tax revenue. Sales tax revenue is the second largest revenue source for Durham County government and is entirely related to economic activity. The estimated current year sales tax collection is expected to come in well above budget estimates. In fact, it is expected to increase 6.4% above what was originally budgeted. That overcollection for the current fiscal year, along with estimated growth of 5% in sales tax for next year, equals an $11.5 million increase in sales tax revenue, or a 12.2% increase. It should be noted that $4.6 million of this increase will go to capital financing fund, and that's according to our board policy, while $6.9 million helps fund many different general fund initiatives. So the estimated 5% growth in sales tax collection revenue for next fiscal year is relatively conservative. However, it still reflects a possible unknown and, as of yet, played out economic consequences of the COVID pandemic. Now let's look to share about other revenue sources. So here, additional revenue sources that have increased significantly for the upcoming year based on current trending include the following. Medicaid Hold Harmless Fund, increasing by $5 million. Register of Deeds fee revenue, increasing by $2.7 million. EMS patient fees, increasing $3.3 million. The increase in these three revenues alone equal almost 2 cents of property tax. Even though there is no recommended increase in this proposed budget, it is worth noting that an additional 1 cent of property tax would bring in a little over $4.8 million. And a half cent would bring in an additional $2.4 million. Turning next to our American Rescue Plan. Durham County will expend nearly $63 million in American Rescue Plan funds over the next several years. These dollars will support the public health and economic recovery efforts resultant from the coronavirus pandemic. Further, the resources allow for infrastructure investments, which are essential for the community's growth and viability. After receiving input from the community, from our staff, from our board, a spending framework was adopted by the Board of County Commissioners that aligns with the U.S. Treasury spending guidelines and the board's strategic plan. The plan supports transformative, equitable, and evidence-based investments. This recommended budget includes a $6.5 million allocation of ARPA funds, with additional allocations occurring in upcoming months through requests for proposal process. While the general fund is where the vast majority of daily activity and spending for government services occurs, there are a number of other funds that serve specific county financial and operational purposes. These include the already mentioned special tax district, the debt service fund, as well as our sewer utility fund. The total county budget, including all of these funds, increased by 8% to just under $800 million. While the general fund, which is a subset of that total amount, increases 8.97% to $550 million. Here you see listed some, but not all, of the increases in the general fund. But some of the increases include the increased employee health insurance cost, increased funding for Durham Public Schools, compensation adjustments for county employees, the ARPA funding in the general fund, new position, pre-K support expansion, and a number of different planning documents, as well as plan implementation costs, and economic development incentives that support a growing number of businesses who choose to locate in Durham County. Now I'd like to move toward sharing a few highlights of major items that were funded within our goal area. One of the main priorities, as expressed by the Board of County Commissioners in the strategic plan and reiterated during recent board retreats, is education. And this budget recommendation reflects that priority, with Durham Public Schools continuing to be the single largest expenditure for Durham County government at $176 million, or 32.7% of the entire general fund budget. And this is housed under Goal 1. This funding includes a current expense increase of $9.88 million and a per pupil funding increase of $359 to total $4,333 per pupil, which is a 9% increase. The county also provides approximately $48 million in indirect support to Durham Public Schools through a number of different departments and programs. DPS will be receiving significant federal COVID-related funding over the next several years, up to $136 million, and this funding will also go a long way towards supporting the student needs that have come as a result of the pandemic. So we would love for you to note that the county's commitment to education continues to be unwavering. Another integral part of Durham County's support for education of all its residents is funding for Durham Technical Community College. This educational system provides a myriad of services, degrees, and opportunities that either continue education after high school and towards college, or towards a high-paying, stable, and lifelong career. Total funding for DTCC increases $789,000, or 8.81%. Of that increase, $380,000 is for Durham student scholarships, designated through board policy that allocates a portion of Article 46 sales tax dollars collected. A total of $1.89 million of total county funding to DTCC is for Durham student scholarships. Durham Technical Community College will also continue to support and enhance an extremely important pipeline of trained workers for technical jobs in the region a second year, which the funding equates to $500,000 for the DTCC Back to Work initiatives, as well as the Bulls initiative and Life Sciences Talent Pipeline. As a number of life science-oriented companies have chosen to locate in Durham County, discussion soon arose among various economic development groups, the county, and DTCC around providing them with the human capital that was necessary. These programs will help provide or enhance the skills of local residents so they can get and keep these jobs. More jobs filled by local workers means more dollars in the local economy, which means a more vibrant economy for all Durham residents. Next, we'll move to Goal 2. Goal 2 highlights include supporting our foster care family. With changes at the state level in their funding structure, an additional financial burden is being passed down to local government. We will never question continuing the necessary investment to serve these children and families, and in turn, I'm recommending an additional $275,000 to fully support this important program. Now, out of all of the staff I've met over the past couple months, some of the most passionate and skilled are those who are serving in our new Community Intervention and Support Services Department. This new department puts under one leadership umbrella our Bull City United, Project Build, and My Brother's Keeper program. This jointly funded initiative with the City of Durham has a bright future with this group of employees' positive impact on our community and their effective violence prevention program. Violence interrupters and outreach workers work extremely hard to mitigate conflict within census tracts before violence occurs. They stop retribution and reduce gun violence that often comes from a lack of communication within the community. This budget supports this staff with an additional position for critical administrative support and also moves the department to new, more appropriately located space for their programs. And now everyone likes a good book. And so this budget supports our library's request for more books. We are committing additional funding to enhance the digital and print collections, which have seen marked growth these past 2 years. I'm excited to note the continued support and expansion of the school health nurse program for Durham Public Schools, with the recommended addition of 3 school health nurse positions. This addition continues the board's ongoing initiative to have 1 school nurse in every Durham public school. With this addition of 3 recommended positions, it brings the total number of school health nurses to 32, which is only 12 positions short of having a school nurse position in every Durham public school. County management and commissioners are focusing on improving Durham County maternal health. I'm happy to recommend 2 positions, a maternal health specialist and a maternal health nurse lactation specialist. The maternal health clinic serves primarily minority, Medicaid-eligible women and is one of the busiest areas of public health in our public health department, averaging 30 to 50 patients a day. The pandemic and its effect brought into focus also the need for food security for our most vulnerable residents. This recommended budget takes a real step forward in defining the problem and potential solutions with $475,000 that will be dispersed in the form of grants to support Durham County emergency food providers with food, infrastructure, as well as materials and supplies. Another $150,000 is budgeted to conduct a community-centered Durham County food system assessment and also create a food security plan. I am also happy to point out that this funding will be offset by expected FEMA reimbursement revenue for early pandemic-related costs which were incurred by the county. Moving on to Goal 3. The Goal 3 budget highlights funding the replacement of 36 Sheriff's Office vehicles for the upcoming fiscal year. These replacements include 20 hybrid SUVs, supporting the county's effort to reduce local government greenhouse gas emissions. Updated fees are also recommended for both the EMS division and Fire Marshal division. EMS proposes updated fees that provide greater parity across all fee categories and also addresses rising costs due to supply chain issues and increase in call volume. Durham County's fire prevention program fees have been redesigned to align with current responsibilities. And I know that one of the funding priorities that our board is excited about is the fall 2023 opening of a new 36-bed youth home facility. In order to have staff trained, in place, and ready for the opening of this facility, the youth home budget contains partial year funding for 5 new youth home counties. Equitable access to services. That's one of our continued commitments that the board has made to the Durham community. And this includes access to citizens engaged with the judicial branch. For this reason, I am recommending time-limited funding for an assistant public defender position, as well as an assistant district attorney position, to address caseload backlogs and continued low bond cases. These positions will be supported with ARPA funding for the upcoming year. Also, our Register of Deeds office. The Register of Deeds office is the custodian and manager of a significant number of public records. They've seen an increase of 25% in the number of documents that have been processed over the past 5 years. Providing prompt, accurate records to county residents is an essential county service. That's why I'm recommending a Deputy Register of Deeds position to work in the office's Vital Records Division. This recommended budget also supports an appropriation of $150,000 to create a Durham Community Cultural Plan. The updated plan will address challenges such as the constrained real estate market, as well as the COVID-19 impact. It will also help to reflect the current demographics and the cultural identity of Durham County. The City of Durham will match this funding for a total appropriation of $300,000 to the Durham Cultural Advisory. Next, let's look at public transportation. Public transportation continues to be an area of intense focus for our board. To that end, I am recommending a transportation planner position to support the administration of the Durham Transit Plan. I am also recommending a contract and financial administrative support position to provide specialized administrative support to both the transportation as well as the economic development departments, which both departments have a rapidly growing number of contracts, grants, interlocal agreements, and other projects. The county continues to support its economic development investment program, which helps attract and retain new businesses and industry. This recommended budget supports more than $3.3 million in incentive payouts, which is a $978,000 increase from the previous fiscal year due to an increased number of incentive agreements. The Board of Commissioners recently approved a comprehensive plan to transition all county operations to renewable energy by 2050 and at least 80% of operations by 2030. This recommended budget supports the aggressive implementation of that plan with the addition of one energy project manager. The total cost of the renewable energy plan, which this position will direct, is estimated to be $40 million. Next, the Sewer Utility Department. This is an enterprise fund agency that fully supports operational costs through fees charged to customers. In this recommended budget, I'm proposing to add 3 new positions. The first will be a grant administrator who would be responsible for all phases of grant development, as well as evaluation and compliance. The second position is a pre-treatment technician who would support all aspects of the county's pre-treatment program. The third position is an engineering technician, which would support timely processing as well as bolster service efficiency. Sewer consumption rates will increase in this budget by 10% to address anticipated investments as well as costs related to operations to continue to ensure our high level of operational readiness and environmental protection. In addition, the Stormwater and Erosion Control Fund, which is another enterprise fund agency, has one recommended new position included in this budget. The position is a Stormwater and Erosion Control Technician. Additionally, I am recommending an increase in the Stormwater Utility Fee, the department's primary revenue source. The fee will increase from $24 to $48 per equivalent residential unit. This will result in approximately $815,000 in additional revenue. The rate increase is one step in a larger plan to incrementally increase the stormwater utility fee to $96 per unit by fiscal year 2025-26. The increased charges will cover the cost of complying with the Falls Lake and Jordan Lake rules, which are nutrient management strategies to restore water quality in the lakes by reducing the amount of pollution which enters upstream. Now we'll move to Goal 5. Goal 5 departments largely support the efforts and ability of our more public-facing departments. And for several years, these departments have not seen the type of personnel growth that our more public-facing departments have seen. However, the growth has demanded more service and reliability on the critical nature of these departments. So this year, it was my priority to ensure the departments that support these other departments were given the personnel necessary to make public-facing departments the best they can be. Within county administration, we will propose a new chief executive officer, grant program manager, as well as a public information officer to ensure that equal access, fiscal opportunities, as well as internal and external county communications are optimized. As demands on the Human Resources Department continue to grow, we need to invest in positions that will adequately support our workforce, as well as the workload. Therefore, I am recommending a senior human resources analyst position and a data analyst position to support human capital decisions throughout our organization. Increased intergovernmental funding received by Durham County, such as the federal ARPA funds and the FEMA funds, they've necessitated additional human resources needs for our finance department. With that in mind, I am recommending 2 compliance specialists and 1 accountant position to ensure that our county is compliant with federal and state awards, as well as grant-specific requirements. I am also recommending the addition of 4 positions in our General Services Department. They include a security technician, an electrical supervisor, a stadium events coordinator, as well as a maintenance technician. The increasing complexity of building systems and the need to more timely deal with emerging issues have created the need for a substantial increase for related position oversight. Also, 1 new paralegal secretary is included in the county attorney's office for ease of the overwhelming caseload increases, and it will split the workload for the child welfare team and provide much needed support to the attorney's office. We also must maximize our technology applications in order to maximize efficiencies and minimize the reliance on human capital needs. So to do this, we need an appropriately staffed IS&T department that can implement technology solutions and support departments using those said solutions. With this in mind, I am supporting 4 new positions for IS&T. 2 business analysts will work to determine business challenges, needs, and processes, so they will relate to new technology projects. The 2 business analysts will work to determine business challenges, needs, and processes as they relate to new technology project requests. I'm also recommending 1 technology support specialist who will work to ensure proper computer operation for all Durham County employees. They will assist with IT support, and we will also recommend 1 IT project manager that will see approximately 15 to 20 new major projects each year. I'm also recommending a senior personal property appraiser in the tax department. So as you can tell, I really want us to be appropriately staffed to be able to provide the services and programs in the most effective and efficient manner. With that said, I look forward to us providing and delivering services in the community to meet our residents where they are. I'm excited to announce a new Durham County on the go vehicle, which I refer to as Deco on the go. This new initiative will bring services directly to Durham County residents. It is my intent that this vehicle will visit neighborhoods, will go to events, and all other community gatherings to connect residents with county employees, to help us expand our reach, to help us provide services in areas that are in need of them, thereby improving the outcomes for our residents. Examples of possible services include engagement with social services workers, workforce development, resources, and connections to Wi-Fi. Lastly, included in this budget for the 2nd year is the joint Durham County and City of Durham funding for a master aging plan. We want to make sure we continue to support our county's older adult population. So staff and I look forward to working with our community and with our board to deliberate further on this recommended budget. Budget work sessions are slated to begin on Tuesday, May 17th. This is where we will provide an overview of the budget, a more in-depth overview of the budget, as well as the environment in which we develop the budget. Subsequent to that, another work session is scheduled for May 19th to begin the review of the departmental budgets. And then on Monday, May 23rd, the board will hold a public hearing for the FY 22-23 budget as a part of the regularly scheduled meeting. Additional work sessions will occur on June 2nd and June 6th. And if additional work sessions are needed, we've scheduled June 8th to hold an additional work session. All moving towards the date of June 13th, when we plan for budget adoption. So with that in mind, I will say it has been a delight of mine. It has been a pleasure of mine to get up to speed with Durham County's complexity, to hear from the many perspectives, to hear the many voices, to hear the needs, to hear our commissioners' goals and desires, and to also hear from our employees, their concerns and their stresses, all in hopes of developing and recommending a budget that will largely reflect and address the needs and the actions and the initiatives from everyone that has provided the input. It also reflects the reality that Durham County finds itself in after climbing out of a 2-year pandemic and everything that comes along with that. So going through this budget development process, it reminded me that every citizen, every visitor, every staff person, every business, we all have a stake in this budget. And it is my desire that the development of this budget will create the services and outcomes that make up a thriving and an equitable, high-performing quality of life for every person that resides in this community. So with that in mind, I invite you all to take a look at this budget document. Copies of the recommended budget will be made available online at the Durham County website, and citizens can view the entire document, as well as find links to interactive recommended budget reports there as well. So with that, I conclude this presentation of the fiscal year 22-23 manager's recommended budget, and I look forward to the upcoming discussions with our board, and I also look forward to the great outcomes that we will achieve through the dynamic services and programs that will be rendered to you through this budget. Thank you so much for your time.
All right, all right. Thank you. Thank you, Manager. That was exceptional. We appreciate all that hard work. That's been in 2 months? Yes. Wow. We are glad you took your time in getting up to speed. Thank you. My pleasure. So, all right. So we've got a few other items on the agenda. Commissioners, we have our consent agenda. We have 15 items on the agenda. Are there any items that commissioners wish to pull? Not seeing any hands. So I will ask for a motion to approve these items that we've already previously discussed. Items from, starting with 220229 through 220268.
Madam Chair,
I have a motion.
I move to approve the consent agenda.
Gulam, do I have a second?
I move to second, also applauding the interlocal agreement that we're doing with schools for renewable energy. But that was the only one I wanted to highlight, so I second.
Thank you. And do we have a roll call?
Commissioner Alam,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. Consent agenda has been approved unanimously. We have a, down to other business, 22-0249, draft Durham FY 23 annual transit work plan. The board is requested to receive and approve comments on the draft Durham FY 23 annual transit work program, and we have Ellen Beckman, Durham County Transportation Manager, here to share additional information
and answer any questions.
Thank you. So on May 2nd, at the work session, there was a discussion of the FY23 work program, a presentation. Aaron Kane here, transportation manager, planning manager for the DCH Sampio, is here as well. He gave that presentation, and just as a reminder, that's the annual budget for the use of the county taxes and fees for public transit. So as described, there's 2 actions for the board related to this. The first is the approval of the comments on the work program. So the board approves comments for consideration by the staff working group, who recommends the final budget, and then the Go Triangle board approves the work program. And then the second action, which will occur on May 23rd, is the approval of the transit plan amendments. So there are some budget items that raise to the level of being a transit plan amendment, and that requires approval by the Board of Commissioners. There's a public comment period open through May 10th. So the action today is for approval of the general comments on projects that don't meet that threshold of a transit plan amendment. We had a pretty thorough discussion of those at the last meeting, and I've taken those into consideration in drafting the recommended comments. Just briefly go through them. So first, there's a request from Go Triangle for an additional 0.25 FTE for tax district administration, and the recommendation is to defer approval of that until the transit governance study is complete, and we've developed a new ILA and kind of decided on the appropriate roles and responsibilities moving forward for administration of the funds. The second item is a request from the city for 3 FTEs for transit project implementation. And again, the recommendation is to defer this approval until we've developed an agreement with the city on transportation funding responsibilities. There were a lot of questions, I guess concerns about what the staff would do and how it supports our transit plan. I hope that we can have a presentation from the city soon to discuss all their projects and answer some of those questions. I do think that the city does have staffing needs, and we want to move forward on this as quickly as possible, but we really need to have that agreement and discussion in place to move forward. And then thirdly, there's a request from the city for design for 2 corridor projects on Fayetteville and Holloway Streets. So these have been previously approved by the board in FY21, and the city has been studying, planning for these corridors. They're kind of evolving to be more pedestrian safety projects with also transit stop amenities. So we don't, the comment is that the staff working group should develop a process to review project scopes, set project scopes, and just make sure that the projects and the cost are meeting the intention of the boards when they approve the projects. So this is kind of a bigger governance issue that needs to be addressed by the staff working group long term. It also raises issues of the funding for sidewalk construction, and again, the need for an agreement with the city to discuss how those sorts of facilities should be paid for. And then lastly, there's a recommendation that the staff working group consider making sure that a project focused on bus speed and reliability is funded. And there's a proposal, there's a city project that's been in the planning stages to look at that. So this would look at things like exclusive bus lanes or other infrastructure to speed buses through downtown with less delay. It was a priority of our transit riders when we did transit plan engagement. And we want, I guess, more information about how that project can move forward. And hopefully it could potentially be incorporated into some of the city's Better Bus projects. So those are the comments in general. And overall, the recommendations just point to the need for, better governance, oversight, and accountability structures. So we'll be working on that with the transit governance process and with the new transit plan. I think the key issue is to make sure that working on this does not hold back our progress. These are issues that I think but these are projects that we want done, and we need to make progress on it. So I hope that we can work on this agreement quickly, and to have further discussion with the city and hopefully bring back some of these requests for consideration at a later date. But so those are the comments in general. What the action is to endorse those comments. It will be considered by the staff working group later this week in the development of the final recommended work program.
Thank you so much, Ellen. You know, as you work so hard on all this stuff that we just keep throwing at you, and I just want to say thank you for the hard work that you do. And I am really happy that some of these things like the FTEs are delayed until the study has been done, because that's what needed to be complete. You're working really, really hard to get that study complete, and we need to be able to include those things in it. The one question that I do have that's not in here any place, and maybe it doesn't need to be in here, I don't know what's wrong off here. Bus shelters, where would those be? They would not be in this plan. What would they be in a different plan for the city?
No, so in the work program, there is funding for bus stop improvements, and that's actually one of the projects that meets a transit plan amendment threshold. There's an increase in cost for that for next year. I think it's to $3.75 million for next year. It's a Go Triangle project. So this is a situation where the city and Go Triangle work together to develop bus stop improvements.
Right.
It's a Go Triangle project, but it will be improving bus stops in Durham. It's a long-term goal of the transit plan to improve every bus stop in Durham. We're not able to do it all at once, so there's going to be packages of projects brought forward over the course of several years to do bus stop improvements.
All right, thank you. Other questions? Mr. Jacob?
Yes, well, I support everything that is recommended in the most recent memo that you have provided to us, Ellen. Thank you very much. So I would just, when we vote on this, would we vote to specifically reference those comments? I was also, I'm just asking, is that what we would do, specifically include those in the motion?
Yes.
And also, you had previously also provided a very detailed memo at our work session. Do you think that it's important that we also include those comments for the record as well? Because there's a lot of background information that you provide in those for the rationale for some of the issues. I'm just wondering, is it useful to reference both of those documents?
Whatever you would prefer. Those detailed comments have been shared with staff previously in a version.
Okay.
So people have seen that in the staff working group.
Okay.
I did try to make the comments more succinct
Okay.
and to the point for your endorsement.
Well, I appreciate that in what you have provided us tonight actually lays out steps forward. I think that's really helpful. And I'm also really glad to see the last bullet point about bus speed and reliability. Does that include basically, would that be a first step towards even a BRT project between, let's say, Duke and NCCU, or is that something separate?
It is. It's like a building block for a potential BRT project. This would be, looking at right around Durham Station and where all the buses come in and out, and, everyone sees the buses. They all are timed, and they're coming in and out at the same time. And it would look at opportunities to add bus lanes so that that can happen more efficiently, timing with the traffic lights, stuff like that. And that is, what is typically included in a BRT project. It's both the service and infrastructure like that that helps buses avoid traffic and travel more reliably and fast.
Fantastic. I'm really excited to hear that. Thank you.
I just wanted to echo everybody's sentiments. Thank you so much, Ellen, Director Beckman. Couple of things, really, and none of them bad. I mean, I doted on your memo that I got to see on Monday. It was really helpful for me. I appreciate you taking the things that we talked to you about. I always see you feverishly jotting down our comments. But one of the things that the Obama administration and the Biden administration often struggle with, I would argue that sometimes even we here in Durham struggle with, you did something good and I go tell people about it. And we kind of don't do that, right? So you have this other document in here that's 74 pages. And I'm going to read two really quick things. It says, Route 10 and 10B is the third highest ridership route in Durham. The project provides additional trips on weekdays and Saturdays and 30-minute service on nights and Sundays, right? And that's already been implemented. Same thing if I go down here to Route 12, I'll add an additional trip. Anybody who doesn't know Route 12, that's NCCU, Hillside, and Triangle Square, and it says already implemented. I feel like sometimes when people come in and give public comment or they send in letters, they don't know, they remember when it was a problem, right? And when everybody was upset, like, why don't we have more sidewalks? Why don't we have additional services? Why don't we do more Saturdays? Why is there no more 30 minutes? And I feel like you, your team, as well as like this leadership has done a good job of incrementally kind of implementing that stuff. And I just want to know, because this, again, 74 pages, I'll read it, right? That's not what everybody's going to read. I think that there are people who ride the bus that recognize those changes have been made. And maybe, I don't need to ask you tonight because you're like, y'all, I done gave y'all everything I have. Why are y'all asking me questions? I would really be interested in learning ways in which we could share this information with the broader public so that when we get public comment and we look at them kind of confused, like, what do you mean? We already did that. We've already implemented that. I don't want you to struggle with that, and I don't want our staff to struggle with that. And most importantly, I don't want our public to think that we are not listening to them. So if you, either tonight or the next couple of days, can talk to us about how we can share this information with the broader public, who often is very loud and does not ride the bus themselves. I think it would do us all a great service, not personally, but I think it would let the community know that we're listening. So that's just something to think about. But thank you for these 74 pages. If anybody, can't sleep tonight, I promise you page 1 is not a page turner because you'll be asleep before then. I'm kidding. But thank you so much for what you've already done. And I also support the things in this plan. Thank you.
And Go Triangle and NPO staff did a lot of the work on putting the 74 pages together. I want to
Just take the
recognize
credit,
that.
woman. Just take all the credit, woman.
And
Oh,
and you're right. Like, we do need to work on how we talk about this plan. I think with our new plan coming out soon, and the governance study, we'll have an opportunity to kind of reimagine how we share information and engage the public on a long basis.
There are other questions? If none other, what we are voting on tonight is how is the motion? You said the motion approve the comment.
Madam Chair, I
My
think
notes here. Approve the comment.
I'll try to make a motion if you would like.
This is the work plan, the board.
Why don't we take a stab at it? You want to try for it, Heidi?
Just hang on just a second. So you want to include the the minutes or the motion, the notes that were included? Tell us again how the motion should go.
I think what I had written was that to endorse the comments as written in the attachment.
All right. Want to stab at it and endorse the notes as written and add that to the motion? Carter?
Yes, thank you, Madam Chair, for helping us clarity on that. But I would move that we endorse the draft comment that Transportation Director for the county, Ellen Beckman, has provided for us on the fiscal year 23 work program. And endorse comments. And my motion is that we endorse the comments that we've at our work session that have been provided tonight.
So say that again.
I'm sorry. I move that we endorse the comments that have been drafted by Ellen Beckman for us on the fiscal year 23 work program.
And can we get a second?
I second the approval of the comments on the draft on fiscal year 23 transit work plan. Okay.
Okay. And
Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Harton.
aye. So it's been moved and approved unanimously. Did we need, I thought I heard you say two motions. Was it just one?
Just one tonight. There is, on May 23rd, will be a request for the approval of the transit plan amendment.
Okay.
But it's still out for public comment, so we want to make sure that the full public comment period.
All right. All right. Thank you.
Thanks also to Aaron Kane. Thank you, Aaron, for all the work you do
Thank
with
you.
this as well.
All right. That brings us to the end of our agenda, commissioners, and we have a closed session, so the audience being here and those that are watching. So the board is requested to adjourn into closed session to consider the qualifications, competence, performance, character, fitness, condition of appointment, or condition of initial employment of an individual public officer or employee or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or employee pursuant to GS 143-318.11A6. I got a motion to move into closed. Need a motion.
So moved.
Been moved and
Second.
second by Commissioner
Commissioner Long,
Burns. And roll call.
Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. We are moving.
we need to take a vote on hiring a consultant firm, Aligned Leadership LLC, for $40,800 for commissioner training. Can I get a motion?
So moved, Madam Chair.
Been moved by Commissioner Lum. Need a second.
Second.
Second by Commissioner doggone, Jacobs. Call the roll.
Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye. It's been approved unanimously that we will be hiring a consulting firm. Thank you. I'll need a motion to adjourn.
So moved, Madam Chair.
Been moved by Commissioner Burns, second by Commissioner Lum. Commissioner Carter? Roll call.
Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Vice Chair Jacobs,
Aye.
Chair Howerton.
Aye, we are adjourned.